pulmonary plexus. Now, clinical part, these are the conditions that you all need to know about. Pleurisy, pleuritis, that is the inflammation of the pleura. Pleural effusion, as we all know, it is the excessive collection of pleural fluid in the pleural space. Pneumothorax, as the name suggests, is going to be collection of air in the pleural cavity. Pneumothorax is going to be a collection of blood. Pneumothorax is going to be a combination of blood and air in the pleural cavity, and empyema is going to be collection of the pus in the pleural cavity. So you all have studied about pleural cavity in your first year, but these are some of the clinical applications or the implications that you all need to know now. To understand the difference between effusion and empyema, pneumothorax and pneumothorax. Now coming down to the airway the airways were divided into upper airway and lower airway. Upper airway consists of the nasal passages, sinuses, pharynx, epiglottis and the larynx. We'll see each one of them in detail. Sinuses, as you all know, are basically classified into paranasal sinuses and the mastoid sinuses. Paranasal sinuses are further divided into frontal, ethmoid, sphenoid and maxillary. Now these sinuses are named after the bone that they are situated in. Okay, so depending upon the bone, they are labeled as frontal sinuses. So you have two frontal sinus, two ethmoid sinuses, two sphenoid sinuses and two maxillary sinuses. So one thing that you all need to remember is these sinuses, they connect with the nasal cavity via small or very narrow passages. Okay, they are also called as meatus. Now if there is any obstruction in these meatus, the connection is going to be blocked. That is why there is retention of mucus or secretions in the sinus cavity, which in turn gives rise to sinusitis. So inflammation and retention of the mucus or secretions in the sinus results in pain, and which is called as sinusitis. The mastoid sinus communicates with the middle ear. Okay, so any inflammation over there is going to be called as mastoiditis. This is something that you need to know. Now coming down to pharynx. Pharynx is divided into nasopharynx, oropharynx and hypopharynx, depending again the adjacent passage to which it belongs to. So corresponding to the nasal cavity is going to be a nasopharynx, corresponding to the oral cavity is going to be a oropharynx, and just beneath that or distal to that is going to be a hypopharynx. Now the continuation of larynx at the level of say lower border of the cricoid cartilage, that is C6, is called as your trachea. So right and the left principal bronchi, the trachea continues forward or it branches down at the level of carina into two principal bronchi, that is the right and the left principal bronchus. Okay, so this division occurs at the level of carina, that is your sternal angle. So try and locate it on X-ray the next time you see X-ray of any patient. So the average length of trachea is around 10 to 12 centimeters and diameter is